Sergeant Jeff Kennett from the St. Croix County Sheriff's Office.
And I'm Nathan Kenneth. I work for St. Croix County HHS and Behavioral Health. I am the crisis co-responder.
A lot of the calls that law enforcement responds to tend to be dealing with more of a criminal or a traffic-related statutory violations. Responding to mental health calls is more of a situation where we're trying to help the client as best we can to resolve the crisis that they're experiencing in a safe way and in a least restrictive way so that they can continue to go about their day-to-day activities as easily and reasonably as they can. Those calls were a little longer and more complicated because we would do an initial assessment and try and determine what was happening, and then most of what our stuff, the process, would be a telephone call to a contracted service, and there would be phone calls, and then there would be a determination to have a mobile crisis worker respond, and then there would be a whole lot of downtime that was kind of awkward at times with somebody who's in crisis, and now we're sitting around for an hour at times waiting for the next person in the puzzle to show up and do their part. The introduction of the co-responders really helped to increase the efficiencies and limit that amount of downtime because they're able to know where we are and they can either be on their way or answer a radio call.
So my role as a co-responder is, after law enforcement's arrived on scene, de-escalated the situation, and they asked for my response, I'm going to come to the scene. I want to speak with law enforcement when I first get there so that I can get an understanding of what is going on in that situation. Then after I speak with law enforcement, usually what I'm going to do is conduct an assessment with an individual. That assessment includes me just kind of peeling back the layers of what's going on, getting a perspective from that person, what's happening in their lives today, why are we in crisis? And then we have some stock questions that we ask on every single crisis call, and I'll work through those questions with every single person in crisis. Once we've done all that, we'll want to collect collateral information from any other people available on scene or family members that might know that person and understand what's going on as far as the crisis. We'll gather all that information as well. And then what we're going to do is, as the co-responders, I'll come back and I'll speak with law enforcement again, so that we can come together and make a plan on what is the least restrictive, most appropriate outcome for that person. When I go out with law enforcement, we're often out there and we're seeing someone on one of the worst days of their lives. They're having a very bad time, whether that be due to drug abuse, their mental health, whatever it might be. What's really great is when we have the opportunity to have a positive interaction with that person out in the community. Often we're going to leave them, let's say, on a community support plan, and they come in and they start receiving whatever help they might need, or they choose to go out and get it in the county. When we see someone make that decision that, you know what, nope, I'm not going to continue to make these destructive choices in my life and I'm going to go seek treatment, that's just a very, very positive outcome.
And that's really something that comes back on us, I believe, that if law enforcement and co-responders do their jobs well, we've set these people up into a situation where they are better able to understand the benefits of seeking that help, and they may see more positives in reaching out and accepting some of that help so that they can experience kind of a easier time moving forward.
Yeah, I guess one of the things we could say is, like, when we have a positive interaction with someone, they choose help, that's us getting upstream of any potential further calls in the future or anything like that, where law enforcement would be called back, other co-responders would be called back alongside law enforcement. If we can encourage them, kind of get the ball rolling in the right direction, and they accept that help and they want to go that way, that reduces all those future calls that we might have run into that person on. So it's really positive when we can help someone get the ball moving in the right direction in their lives. I think it's been a great program. I've been here from the beginning. I think the relationships between behavioral health, health and human services, and law enforcement that I mean, there were already relationships there, but just the way they've continued to grow and the way we've been able to work together has been extremely beneficial, I think, for the county and for the people of the county. I think it gives law enforcement a good resource that they know and can, we get to be the same people that are coming out all the time. So we get to build relationships with them that help us to provide the most client-centric care possible on scene with someone in crisis, because they're in a very difficult situation. And so when law enforcement knows who they're bringing on, we can really work together well as a team to help that person and have the best possible outcomes.
And I would echo all of that. The being able to make those introductions when we're on scene with these folks and we've already spent some time. Our goal, again, is to create a level of trust with them that we can work towards good outcomes, and being able to kind of capitalize on that trust that we've built by making good introductions with co-responders that we know and trust that are good at what they do is invaluable to the positive outcomes.